Topping the news tonight, what could be a groundbreaking study of the health effects of PFAS contamination. This one centers on pregnant women and newborn babies.
And what researchers found is something every expectant mother who lives near a known PFAS site needs to hear. News 9's Pearl Small joins us live in the studio tonight with more. Hi, Pearl.
Hey, Brian and Amanda. So it's been more than a decade since we first learned that sludge from wastewater treatment plants offered to farmers as free fertilizer contained so-called forever chemicals. Some of those toxic compounds have been linked to some forms of cancer, but a new study released this week says pregnant women who drink water with PFAS in it are putting their babies at risk.
So my wife was pregnant at the time we were working on this, and so I was like, okay, I think we should probably buy a water filter and start filtering our water.
When University of Arizona researchers, including Derek Lemoine and Boga, started studying birth data from pregnant women who lived upgrade and downgrade of known PFAS-contaminated sites in New Hampshire, they found that babies born to women who consumed well water downgrade of the sites had a 191% higher mortality rate in the first year, were 168% more likely to be born before 28 weeks, and there were 180% more babies born under 2.2 pounds than those born to women living upgrade from PFAS sites.
We would expect similar things happening in other states that have similar level of contamination.
Lemoine and Go say they chose New Hampshire not because its contamination levels stood out, but because of the data that is available there. It was the only state that had not only mapped out its 41 PFAS-contaminated sites, but also had more than 11,000 birth records, showing where expectant mothers were living in relation to those sites.
These extremely low weight and extremely preterm births are just really costly for individuals.
The researchers say if the New Hampshire results hold true for the rest of the country, they estimate that the overall health effects could be costing the nation about $8 billion in economic losses.
They have worse health outcomes on average later in life. They lose wages later in life.
Lemoine and Go say the cost is a key point to the research, specifically when trying to emphasize the importance of cleanup and influence policy.
Whenever you talk to policymakers, right, they would say, well, if you want to impose this regulation, it bears costs for cleaning up, treating water systems, cleaning up contaminated sites, right? And this type of research and science provides evidence that, if you don't do it, there's also costs.
The administration is moving to undo the limits for some PFAS compounds, and that, the study says, would probably cost the public even more in the long run. Brian and Amanda.
Really interesting. All right, Pearl, thank you.